Hello, I'm Lee Jun-wook, head of DT Plastic Surgery. Today, in this video, I'll be answering one of the most asked questions about breast augmentation, and that is the recovery time after the procedure. Before the procedure, we check the condition of the patient's breasts. We would first analyze the breast type, and an ultrasound would be performed during the checking of the condition. And on the day of the surgery, the patient has to fast for 8 hours because they'll be put under general anesthesia. And to add to that, before the surgery, the patient will also have an electrocardiogram, a blood test, and a chest test for general anesthesia. On the day of the patient's surgery, while in a fasted state, a design for the surgery would be made. The most important process in plastic surgery is design. This is to record the exact exfoliation process or surgical plan on the body. The operation proceeds according to this. The surgery is then, as mentioned, performed under general anesthesia, and the incision methods include armpit incision, chest incision, and circumferential incision, and the prosthesis enters through the incision. The space in which the implants enter is located in front of or behind the thoracic muscle based on the decision made. In the case of fat transplantation, it enters through the upper subcutaneous fat layer. This procedure usually takes about an hour, or maybe even 2 hours. And after the surgery, you may return home after a recovery process. Unless there's a special or unique problem with the surgical process, there would be a tendency to not wear blood bags or compression bandages. I'll now talk about the day after the surgery. Usually, the day after the surgery is obviously the first day after it. Our recommendation is that you visit the hospital on the first day after the surgery. The reason is to identify possible acute complications that came up during the surgery, to see if there was bleeding or if there were any other problems. That's why one should visit the hospital after the surgery. A lot of people say they're in pain by the day. What happens a week after the surgery? If there are any surgical threads, then this is when it gets removed. Same goes for bandages. They'd get removed and compression underwear is worn afterwards. A week after the surgery, most of the people who come to the hospital experience the kind of mild discomfort only possible while living their daily lives. In other words, there is no major pain. I recommend doing light cardio a week after the surgery, such as walking for about 30 minutes, as these light exercises improve the body's overall condition and help speed up recovery. The swelling also subsides quickly, and the body progresses better too. But just because you don't have any severe pain doesn't mean you can do heavy exercises such as running, as that will cause fluid retention between the space from the implants. So I don't recommend doing that. A month after the surgery, since it's the recovery period, you won't feel any pain by then. Usually, for a month after the surgery, women who haven't given birth would say that the feeling is like having a rock on their chest, while those who have given birth or have breastfed say it feels like they're producing milk again or they're suffering from mastitis. But rest assured, all these things usually go away after a month. Regarding the breast shape though, if you have swelling in the upper breast, it doesn't disappear within a month. After the surgery, breast gets swollen and the swelling goes down. After a month, some people say that the volume of their chest has declined, but that's normal. And such recovery process means that you've successfully normally recovered. So now, you're allowed to go back to things you couldn't do back then, such as exercising. But since you haven't exercised for a whole month, it's utterly important for you to take it slow and gradually increase the amount of exercise. It doesn't hurt as much as you think. Usually the pain doesn't hurt as much after 2 weeks, and that would cause those who used to work out to gain confidence in exercising with the same intensity as they used to before the surgery. But that will cause 2 problems. When you exercise, you get sweaty, but the membrane hasn't been made up yet around the breast implant, and the waste is excreted even inside the body. So you might experience fluid retention around your breast implant, and then capsular contracture might occur. The second problem is that if you exercise when your blood vessels around the implant are not fully recovered, they expand, and so your breasts turn red. Once it turns red, it'll take around 3 to 4 months until the redness goes away. It's no use even if you get special treatments or something similar. It's always better for you to take care of yourself for a month than to get treatments to fix problems after they already happened. It's much better for your life moving forward, so I recommend you stay cautious for a month after the surgery. And people used to suffer from muscle stiffness in the past. But now, surgical techniques develop for the better, so you don't need to worry about that. Even those who had surgeries on their pectoral muscles have no difficulty in exercising after a whole month of recovery. But since your exercise starts again after a month-long break, you should start over as if you were a beginner. Now we're 3 months in. For your breasts to look 100% normal after the surgery, we could assume that it'll take a whole year. If I was to say that 1 year after the surgery gives 100% of the final shape of your new breasts, we could assume they'll hold 75% of the shape in 3 months and 95% in 6 months. It means that if 75% of the entire process is done during the first 3 months of when the changes occur, there's the possibility that things could still get bad. After 3 months, the shape is starting to come out and you have no problem with your daily life. But too much hard activities can make your implants fall to the bottom due to heavy pressure. And if you're wearing tight clothes around your upper body, it may cause swelling at the upper parts of the breast. And if strong pressure is put around the implants, even if the membrane is considered stabilized at this point, it is not completely stable, so it may cause capsular contracture, meaning the membranes thicken. So yes, you can see that the breast is taking shape in the first 3 months post-surgery, but it is still incomplete as it is still in a recovery stage, so I recommend still being careful for 3 more months. Also, we recommend that patients be careful when sleeping on their side during those 3 months. That's because when you sleep on your side, the 2 implants could touch one another or could get stuck inside, and when you lay on your back, the implants can expand outwards. But after 3 months, when you lead your daily lives, the implants won't interfere as much anymore. But as I said earlier, when you exercise vigorously, there may be some changes, so be careful with that. Today, we talked about the before, the after, and the recovery of breast augmentation. If you have any questions regarding breast augmentation, please let me know, and I'll try my best to answer them. Thank you.